Thank you. Okay, so good evening and welcome to the NYC Health and Hospitals Fiscal Year 2021 Annual Public Virtual Meeting for the Borough of Brooklyn. Good evening. Before we start the formal program, I would like to call to your attention that we have interpretation services. If you require these services, please call 212-788-3359 for French Creole and for Spanish. So thank you. So my name is Jose Pagan. I'm chair of the board of directors, and I want to thank you for joining us. And I would like to introduce the other board members who are here tonight. Dr. Vincent Calamia, City Council representative for Staten Island. Robert Nolan, City Council representative for the Bronx. Barbara Lowe, City Council representative for Manhattan. We also have Fenioski Peña Mora, Frida Wang, and Philip Wadley with us tonight. And also on the panel are Blanche Greenfield, Deputy General Counsel and Moderator for the evening, and Colicia Hercules, Secretary of the Corporation. So on behalf of the board, I would like to extend our thanks and acknowledge the leadership at our Brooklyn facilities, Sheldon McLeod, Kings County, and Gregory Kalist at Woodhull, Svetlana Lipianskaya at Coney Island, and David Weinstein at Susan Smith McKinney, and all the dedicated staff for providing exemplary service to our public health system and the people that we serve. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. So now I will turn the microphone over to Matthew Ziegler. He's a Senior Vice President for Managed Care and One City Health CEO. He will be presenting Dr. Mitch Katz, our President and CEO, his remarks. He's unable to be present with us due to an unavoidable conflict that just arose. So, floor is yours, Matt.
Thank you so much, Mr. Chair. Good evening, everyone. Good evening, Brooklyn. Apologies on behalf of Dr. Katz. He wishes he could be here, but I'm honored to present to you all this evening. A little over a year ago, our health system admitted its first patient with COVID-19. Hard to believe, but through the last year, our heroic frontline teams have faced the unimaginable. We've experienced the same fears, loss, trauma, and anxiety as many around the city. But this trauma has brought us together as a unified health system to support each other, keep our patients safe. We have saved lives in every community around this great city. We fought COVID extraordinarily hard. We've tripled ICU capacity, brought on thousands of additional staff to support our patients and teams. We transported patients from our hard-to-hit hospitals to others in our system around the city. We secured millions of pieces of PPE and other protective equipment to secure our staff and our patients. They've made us stronger and more efficient as a health system, and our response to the second wave of COVID shows how much we have learned and grown from that experience. It's nothing short of a miracle that there are now 3 multiple safe and effective vaccines available, and the end of the suffering is in sight. While there's much hope ahead, thanks to our hard work, we still grieve extensively for our friends, relatives, coworkers, and others lost to this horrible pandemic. I want to take this moment to thank all our community members for their support of health and hospitals over the last year. I remember vividly the 7 p.m. clapouts, the pots and pans being banged out of windows. It meant the world to us, to our teams, and it supported us in our time of need and our essential role for the city. This past year has shown extensively how essential our public health system is to the city. There's no challenge we cannot meet when we work together and focus on protecting the most vulnerable New Yorkers under our care. Last year, our emergency departments cared for more than 111,000 COVID patients. 55,000 patients were hospitalized with COVID-19 in our hospitals and discharged safely home. We have provided our staff a range of peer counseling, respite rooms, other mental health services to help them endure and prevail. We're incredibly proud of their resilience and strength over the past year. We prioritized testing since the early days of the pandemic, and we have built the country's most successful testing and tracing operation, the New York City Test and Trace Corps. In the last year, we've done over 3 million COVID-19 tests. Thousands of New Yorkers have experienced the dedication and strength of our system for the first time. Test and Trace brought on more than 4,000 contact tracers to help drive this work and reach thousands and thousands of New Yorkers we help to protect our community from COVID-19. Vaccinations are the critical work of our system now. Our NYC Vax Champ campaign has helped educate and address vaccine hesitancy among our staff and community, provided 24/7 service at many sites around the city. We've administered nearly 1 million first and second vaccine doses. We're also looking to the recovery from COVID-19. 34,000 patients with COVID-19 are in our care for the long term. We have built 3 new COVID-19 centers of excellence in Bronx, Queens, and of course in Brooklyn. Focus in the communities hardest hit by the virus. These will help address the long-term impacts of COVID-19 and the important health equity challenges that were so painfully revealed during the pandemic. Intensifying our commitment to address health equity, focus on diversity and inclusion is a critical part of our work and our recovery from COVID-19. I'm so grateful, we're all so grateful and proud of our staff for everything they have done and continue to do for thousands of New Yorkers who call NYC Health and Hospitals their healthcare home. Again, we really thank you for being here tonight. Thank you for your support of our essential public healthcare system. Now let's proceed to the main purpose of tonight's meeting, to hear from you, members of the community. Your input is so important to us and the future success of the system, so we are ready to listen. I will now turn it over to Blanche Greenfield to outline the proceeding for tonight's meeting. Thank you very much.
Good evening, everyone, and welcome. For anyone who's just joined the program, I want to remind you that we have translation services available in Spanish and French Creole. Please call 212-788-3359. Thanks, Matt, for the introduction. My name is Blanche Greenfield, and I am Deputy Counsel and Chief Employment Counsel here at New York City Health and Hospitals. Due to COVID-19 public gathering restrictions, we are convening this 2021 public hearing for the Borough of Brooklyn virtually. This meeting is the last in a series of 5 meetings conducted annually across the city's 5 boroughs. The purpose of the annual meetings is to inform you, the public, about the programs and plans of New York City Health and Hospitals, and to give the public an opportunity to present oral and written testimony concerning our performance here in New York City Health and Hospitals. The oral public testimony given tonight will be transcribed, and along with any written testimony provided, will be forwarded to all the members of the Board of Directors for their consideration. If you have not yet registered and would like to share your comments, you still have a few minutes to register. You have until 6:30 this evening, and just call 212-788-3359 to register to speak. I will serve as the moderator for this part of tonight's meeting. I will now briefly highlight the format and rules for the testimony to be given. This meeting is the opportunity for the Board of Directors to hear from you. The format is not a question and answer. In order to ensure that all registered speakers have an opportunity to testify, registered speakers are allotted 5 minutes of speaking time. On your screen, there is an electronic timer that will provide warnings about the expiration of your time. A yellow light will indicate that the speaker has 2 minutes remaining of their allotted time. A red light will signal that the speaker's time has elapsed, and a flashing red light will let you know that the speaker has exceeded the time allotted. If you don't complete your comments within the time allotted, you have a written statement of your full remarks, you may call 212-788-3359 and make arrangements to submit the full statement into the record. As I noted earlier, your written testimony, along with the transcript of your oral presentation, will be shared with the members of the Board of Directors. Finally, I want to apologize to all of you in advance if I mispronounce any of the names of the speakers. Please correct me if I do so. On behalf of New York City Health and Hospitals, I sincerely thank you for your participation this evening, and we look forward to hearing from you. We ask that you remain on mute until your name is called and press *6 to unmute when you are called to speak. At this point, we are ready to hear from the first presenter, which is New York City Council Member for District 40, Matthew Eugene. Okay, we're going to move along. Our next speaker is Community Board 9 Chairman Fred Baptiste. Are you there?
I am here. Can everyone hear me?
Yes, welcome.
Thank you very much. I want to extend my serious gratitude for being invited to speak for the board today. Again, my name is Fred Baptiste. I serve as the chairperson for Community Board 9 in Brooklyn, and I'm here to speak in strong support of Health and Hospitals Corporation, and specifically Kings County Hospital, located in our district in Brooklyn. I was listening to the accomplishments of Health and Hospitals Corporation and the different components, and I could not help but nod my head in terms of this is more than just words on a document. These are things that as a board, as a community, as a district, we saw. We saw our hospital, our community-based hospital, take the lead in terms of healthcare. And this goes back a little bit in terms of the commitment that was made in terms of making sure there was strong leadership, strong recruitment of talented professionals and staff, strong investments that were made with regards to physical plant, making sure that we had the appropriate equipment, making sure that we had services that were available in the district itself. And this is something that was particularly useful. This paid dividends when it came to the pandemic hitting our city and our district. Our hospital was able to take the lead with regards to testing services. Our hospital was able to take in so many patients that were affected with COVID-19 and give them quality health care. And our hospital was able to take the lead, especially as we pivot now into a recovery mode with regards to vaccinations. I also want to speak very highly with regards to the dedicated professionals who at various times took it on their own personal time to come and speak to our community board and share whatever knowledge they had with regards to the pandemic. I think with COVID-19, we were all learning at the same time. So it was very, very comforting. It was very empowering to have dedicated professionals come and speak with regards to what they knew and what things were going to be best practice to help us get through this catastrophe, I guess is the word that we would use. On a personal note, I want to say that I was born in Kings County Hospital, and I do remember the days when we did not speak as highly of it. But again, it goes back to the commitment and the investment that was made there, where now this is someplace that we can talk to realistically and enthusiastically about. It's a good place to go and get quality health care. Over the last year and a half, I've had to make use of their services, and I went there and I was greeted warmly, and I was treated with professionalism and courtesy. My wife has gone there, who's perhaps the ultimate skeptic, but who's perhaps now one of the converted. And I do want to speak with regards to I won't say her age, my beautiful mother, who had a fall and she broke her hip. We were able to take her to Kings County Hospital, and they took fantastic care of her. Which is something that I and my family will never forget. So in conclusion, I think I'll give back some time, but I just want to say that I have nothing but the highest praise. And I just, offer our support in Community Board 9 with continuing to work with Kings County Hospital and Health and Hospital Corporation in terms of increasing access, increasing quality, and continuing on the trajectory that we've had. And I look forward to even more work and more success in the future. Thank you.
Thank you for your comments. Our next speaker is the Kings County CAB Chair, Warren Burke.
Hi, everybody. My name is Warren Burke. I am the chair of the Kings County Hospital Advisory Board, as well as first vice chair of CD9. I really want to center on tonight is gratitude. it's a coincidence that this hearing is taking place when it was announced today that 70% of the population of New York State has been vaccinated, and that it's been, and we're going back and it's opening up. And that is a major, major thing to our community. And I just really want to thank Health and Hospital, and I'm here to speak about Kings County, but without the support and the leadership of Health and Hospital, I don't know what would have been done, but it's just amazing. In terms of Kings County, I have gratitude to the 5,000 staff members of the hospital. These people have been under the gun before COVID. The staff has really dealt with in following one another the implementation of the EPIC system. Then came COVID-19 one round, then came COVID-19 number 2 round, and now is the reopening of the hospital. What's amazing and we're thankful for is how the staff and the leadership of Kings County Hospital continue to adjust as each demand was demanded. I was just in awe that when it came time for testing, 2 days later there was a testing facility. When it came time for vaccinations, 2 days later there was a setup for vaccinations. And you know, these setups to a layman like myself are not easy. You need staff, you need equipment, you need everything. So it just amazes me their versatility and how they listen and their ears are open. While this was all going on, they continued to give excellent patient care to our residents, which was just terrific. I think at this point I'm supposed to speak about what Kings County needs, and I could tell you we need everything. Through the last 4 years between H&H and the leadership at Kings, we have built a state-of-the-art hospital, and as importantly, a state-of-the-art staff. 4 years ago, when I was really got involved with this whole thing, the hospital has been reborn. There was new leadership in place, and there was new leadership at H&H. And from that time, the hospital has just improved and provided the care that our residents need. What my request is that you keep providing Kings County with money, personnel, and staff so we can continue this upward trend for the hospital and in turn treatment of our residents. I want to highlight the leadership of the hospital. Mr. McLeod, who is the president. Mr. McLeod has a great working relationship with our advisory board. He is transparent, he listens, and he is open. And one of the things that I respect is that he discusses the problems and looks for input. The other people I just want to include, and I'll just name them because these people have been under the gun and have provided the leadership that has resulted in the wellness of our community. Dr. Pulitzer, Chief Nurse Chung, Graham Goulian, and importantly, Renuka Appamorthy. We all know the importance and the demands being met by the hospital now on the mental health from COVID. And I attended a meeting this morning at the subcommittee for the Department of Mental Health. And there's been a huge increase in terms of teenagers and young adults reaching out for services. And I know from discussions that Health and Hospitals, as well as Kings County, is reaching to service those people. Basically, my main comment in terms of leadership and the people and the staff at Kings County, and that goes from the people who keep the grounds up to the president, is that they listen, they're transparent, and most importantly, they implement. And I think that my remarks will be supported by Health and Hospitals dashboard, so take a look. I want to do a shout out and a call out to the communications department at Kings County Hospital. I would say I've been involved with the community board for 6 to 8 years, I forget what, but at the beginning there was no solid strategy and plan. to reach out to the residents of the community, and as important, to be a conduit back, okay, to the hospital. And with Alexis Davis and Keisha Gillies, the whole thing has improved. They've brought us into the 21st century. We are now on social media. And probably the most important thing is that there are now programs with stakeholders. For instance, they implemented a program where there's a once a month series that the community board in Kings County sponsors that tackles certain topics. The last thing I really want to say is that the wellness of the staff is a priority with Kings County Hospital, and it is just so impressive, the resources that are allocated, and I am just really thankful for that, because these people have worked, just worked till they're exhausted. That's
Thank
my
you, Mr. Burke. I
testimony. I want to
appreciate it.
thank you.
Thank you so much for your
You're
comments. We appreciate it. Our next speaker is Community Board 9 Second Vice Chair and Kings County CAB Second Vice Chair, Francisca Leopold. If you're on mute, please press *6. Okay, we're going to move on at this point to Coney Island Hospital CAB Chair, Teresa Scavo.
Good evening, members of the H&H family. I am Teresa Scavo, Chairperson of Coney Island Hospital Community Advisory Board. Over the last 15 months, we have lived through a pandemic and experienced hardship like never before. But today, there is light at the end of the tunnel. On May 21st, 2021, Coney vaccinated 20,000 persons. Over 60% of our employees are fully vaccinated, and we continue to operate our vaccination center with appointments as well as walk-ins for all community members over the age of 12 eligible to receive the Pfizer COVID-19 vaccination. In the fall of 2020, Coney Island Hospital was approved to launch PCI, percutaneous coronary intervention, in our new cardiac catheterization lab. PCI is a minimally invasive procedure that opens blocked arteries or narrowed coronary arteries. With the advent of PCI, patients' outcomes are greatly improved. In times past, patients having a heart attack were transported 20+ minutes away to facilities that offered comprehensive cardiac services. This past May, the Joint Commission conducted a survey of Coney Island Hospital's primary stroke center disease management program, and they are in the process of being certified. The designation is offered in collaboration with the American Heart Association and the American Stroke Association. This will help our hospital be recognized both locally and nationally for our exceptional care of stroke patients. The Joint Commission certification will be a signal to the community that the hospital is ready and able to care for them in their time of need. A project near and dear to the advisory board is a level 1 trauma center. Coney cares for hundreds of trauma patients per year in our fully prepared resuscitation rooms. The hospital has a trauma response team on standby for any incoming codes and performs multiple drills to be ready for patients that are brought in for care. In addition, the emergency department recently appointed an EMS and disaster fellowship trained director for trauma and pre-hospital medicine to ensure preparedness and quality. While we advocate for the level 1 trauma center, The response we receive from the city is that the cost associated with becoming and maintaining a trauma center is prohibitive due to the requirements of 24/7 specialty and trauma surgery coverage. Coney continues to be dedicated to providing community members with all life-saving and stabilization treatments. To that end, we will continue to pursue additional certifications in neurology and cardiology. We survived the devastation of Superstorm Sandy that ravaged our hospital, and now over the next 12 months, Coney will embark on major campus transition with the opening of the new hospital in the summer of 2022. The hospital's leadership has assembled a campus transition committee structure to ensure governance and progress towards stated goals and objectives. The transition structure includes an executive steering committee, a core transition team, and 17 working groups. This project is being led in large part by the frontline staff. They are the ones who are closest to patient care and can help the hospital evolve its process with the patient and family in the center. Our goal is to ensure that patients do not have to travel a far distance to receive quality medical care. We will also continue to focus on ambulatory and preventative care to ensure the overall health and well-being of our community. In closing, I would like to thank the leadership at Coney Island, Svetlana Lipkin-Saya, who is taking Coney to a different realm in New York. Thank you.
Thank you very much for your comments. Our next speaker is McKinney Cab Chair, Antoine Jean-Pierre. If you're on mute, please star 6. Oh, we can't hear you. You may still be muted. Are you there? We're going to move on to the next speaker and come back to you, and hopefully we'll resolve this technical difficulty. The next speaker is a Jacobi nurse and a NISNA president at Jacobi, Kelly Cabrera. All right. We're going to move on to Woodhull Cab member Gail Charles. We can't hear. Can you press star 6? We understand you're there, but we can't hear you.
Can you hear?
Yes.
Okay, good. All right.
Oh, thank you so much.
Good afternoon, members of the Board of Directors, Dr. Katz, President, CEO, and all other present at this hearing. I'm Gail Charles, member of Woodhull Community Advisory Board and a resident of North Brooklyn. Thank you for allowing me to share some ideas at this hearing as a CAB member. I want to acknowledge Mr. Gregory Calise, our CEO of Woodhull, and Woodhull staff, and my fellow CAB members for their dedication, commitment to improving Woodhull and providing excellent healthcare for the residents of North Brooklyn. The CAB is fully supportive of the CEO's vision for making Woodhull the model hospital and hospital of choice for North Brooklyn. Performance of Woodhull staff during the COVID-19 crisis in ensuring that excellent care was provided for all persons who were affected by the COVID-19 who presented to Woodhall was outstanding. In spite of the risks to themselves and their loved ones, the staff worked tirelessly to ensure appropriate care for all, even at the risk of themselves. Many employees were affected by COVID, and some even died from it. But that did not scare the majority of the staff nor cause them to quit. I also want to thank H&H leadership for the support provided during the New York COVID surge to ensure that Woodhall was equipped to handle the crisis caused by the influx of COVID victims. This included extra personnel as doctors, nurses, nurse practitioners, and respiratory therapists, equipment and supplies, especially ventilators, and PPEs, transferring patients out and in to Woodhall as necessary to manage the volume. The community is also grateful to Woodhall for establishing the COVID-19 hub for testing and vaccination, which serviced thousands of patients, staff, and residents. It is also important to acknowledge the tremendous support and appreciation shown by the community, which provided meals, groceries, supplies, and words of appreciation and encouragement daily to our staff. We are more confident that we were much better prepared to deal with future resurgence of COVID or other epidemics because of this experience gained from the first two surges during the last 15 months. Continued support from H&H is critical as we try to normalize operations to continue providing quality healthcare services to the North Brooklyn community. Accordingly, we are requesting your assistance to ensure that the following projects are funded and expedited, including the emergency room renovation needed to upgrade the current emergency room to bring it to the same level of our newly renovated section. This will also help to accommodate the volume of emergency patients served at Woodhall, which will improve privacy, confidentiality, and overall patient experience. Repair of our facade, which will improve the physical plant, make it safer, and also allow us to improve the scaffold that now makes the building exterior very unattractive. Repair and upgrade the elevators, which are now unreliable, dangerous, and cause of dissatisfaction and frustration for patients, staff, and visitors. Upgrade and improve the security monitoring system. Repair the roof to prevent interior flooding when it rains. Our building is about 40 years old and in some cases outdated, which makes it unattractive and difficult to maintain. Since we expect Woodhall to be here for much longer for the community's sake, we should start the planning process to renovate the physical plant and make it more up-to-date and efficient. We are grateful that many of the special services, including ENT, orthopedics, and neurology, have been resumed at Woodhall. This will ensure that our patients have access to these critical services here instead of traveling to other hospitals further away. Behavioral health has also been a major service at Woodhall and should continue to be adequate because of its high need demand in our community. We are concerned because the services are shrinking, although the need is increasing. We understand that this is happening because of the shortage of psychiatrists and other mental health professionals, and that our non-competitive salaries is the main reason. We are therefore asking for help to reverse this trend.
If I may ask you to please try to wrap up your comments. We're going over time. So
Yes.
thank you.
Although we support the corrections medical outposting unit at Woodhall, we want to ensure that it is not a detriment to the Woodhall Hospital. We therefore request your oversight to ensure that this does not happen in order to overcome the fears and concerns of our Woodhall and it's being turned into a prison. Thank you for your continued support of the Board of Directors and agency leadership in helping to make Woodhall a continued success and the hospital of choice for North Brooklyn. Thank you.
Thank you. Thank you very much. Mr. Jean-Pierre, I don't know if you're still having technical difficulties, but I want to remind you that if you call the board office at 212-788-3359, are you available?
I'm on the phone now. Can you
Oh,
hear me?
terrific. We could hear you. Terrific. Welcome.
Thank you. Good afternoon, everyone. I'm sorry about this. Let me just start with this. Good evening. I am Antoine Jean-Pierre, Chair of the New York City Health and Hospital McKinley Community. Despite the challenges everyone faced, I take this opportunity to thank the New York City Health and Hospital Board of Directors for holding this virtual hearing so we can speak to you about our Center of Excellence. Called me to McKinley like a lion and has now left like a lamb. As it entered and altered the trajectory of normalcy, care was never compromised. Yes, we suffered COVID-related deaths, shortage of staff, and other amenities, but McKinley staff took the charge as usual to ensure their residents and staff were well taken care of. We had our challenges. Staff got scared and fearful to the point of staying home, but there were those who stayed and stood up like soldiers in the battlefield and came to work every day. They are the real healthcare heroes. The staff at McKinley is quite unique, so too is the CAB and auxiliary. Because McKinley operates under the village system, they roll up their sleeves and help each other out to the point of crossing departments. At McKinley, recreation programs had to alter or be tweaked to help residents engage and occupy. Visits were replaced with virtual calls. Community-based organizations wrote letters and sent cards. Recreation staff running up and down the social distance hallway to play bingo, singing to them, comforting them. The auxiliary emptied their gift shops and gave everything away to the McKinley residents. It was a tough year, but the tenacity and resiliency of McKinley staff, along with their leadership, paid off. They followed every protocol and policy set forth by the Department of Health. For the past week, their numbers of positive staff and residents remain at zero. Before going, kudos to the nursing staff of Ann White, Akinyoyo, and Robin Holland, MD, for their swift implementation of healthcare plan that saved a lot of residents' lives. When COVID entered McKinley, all programs were immediately augmented to suit the new normal. We opened 2 areas were strictly dedicated to COVID, all in an effort to keep McKinley put other plans into actions by having window time calls with families. We're happy to see their loved one being well taken care of. The Helping Healers Hand programs were fruits of staff were assisted with alleviation of their fears. Then came the vaccine. Though it was challenged and continues to be, McKinley never wavered. The effort to vaccinate the education today, I am happy to report 78% of the residents are vaccinated, 59% of the staff are engaged. The residents were challenging but recreational departments. Under Janet Largy, held it together by innovatively bringing programs of interest to the residents. Even the nursing department created a social program for one special time with residents called Tea Time with the ADN. Staff was continuously engaged by having a compassion cart of goodies delivered to them weekly. Mr. Weinstein and his team never dropped at the ball. They kept staff highly motivated by having weekly intervention of events of engagement, one of which is the opening of the Care Experience store. Staff is awarded a McKinley dollar for every good act, and this dollar can be redeemed at the store. Swabbing for staff was done 2 times per week. The beauty salon was now roving. Week celebration was done differently, but it was done and it included all of the state staff. Although the polling site was closed and still is, all residents who were eligible to vote, did so, and helped out of the Recreation and Public Affairs leadership. One can observe the positive change in attitude and approach to care at McKinley. Thanks to the HHC Board of Directors for the opportunity for addressing this. Thank you, Ms. Maureen McCloskey, our Senior Vice President. A special thank you to the best liaison who truly guided us and kept us informed on our toes. Angela Cooper. She always kept us up to speed and important issues facing McKinley. Dr. Katz, thank you for your support. And as we look forward to a novel way of operation for healthcare for our elderly in our community. Thank you very much for this opportunity.
Thank you. I'm very glad you were able to connect. Well, we thank everyone for participating this evening. This brings the meeting to an end, and thank you again. This is your public hospital.
Guys, bye.
Have a nice evening. Bye-bye.
Bye.